Hey, and welcome back to Psych and the small snippets called Psych Nurse. What have you got in your toolkit? Yeah, so we're continuing on with the theme today, and this one is around about medication knowledge that psychiatric nurses need um, to work with their patients. And, psychiatric medication ranges from some anxiolytics to SSRIs, antidepressants, dealing with anxiety and depression. We look at mood stabilizers, people that have bipolar affective disorder, and the different types of mood stabilizers that are available for them to use, and also antipsychotics. It's very difficult sometimes to just say this medication will fix that person. There's to a certain degree some guesswork involved. We kind of know how medications work and how they affect the brain. However, one medication might work for me but not work for you. So sometimes a combination of medications are used to counter anything that may be happening with another medication or support another medication. But that also brings along its problems as well, because sometimes it can be difficult to get our patients and encourage them to continue with their regime. Side effects like not being able to get out of bed in the morning, or no libido. Asking a young man in the prime of his life to take a medication that's probably going to reduce his sex drive and make it difficult for him to actually do that, be part of that, by taking a medication that's going to stop him from hearing voices, or that might reduce his mood down or something like that. So it's very difficult sometimes to get people to take medications. So psychiatric nurses need to understand how medications work, how they work with each other, how they're going to affect the patient, and how they're going to speak to a patient that's experienced some issues around the medication regime that they're on. So there you have it, psych nurses. Another tool in your toolbox is understanding what medication is. So it's a good idea to read up on what you can, and try and get some user views. Try and get some views from actual patients that take it. Because when you read literature, they're all wonderful drugs. However, and they do talk about, less side effects with certain medications. But, talk to people what medications are like and what they feel like and how they might have overcome it, or their feeling on it in general. And then it might give you a better understanding about where to go to now with your patient. What's going to happen down the line? What can you predict there? How can we support them? It's a really, really useful tool to have. Medication isn't always the answer. It's part of the answer. And there's lots of other things that we can use, as we've already discussed in previous snippets. So, yeah, go out there, improve your medication knowledge. It's a skill, and it's in your toolkit. Bye for now.